As a result of drug resistance, antibiotics and other antimicrobial medicines are becoming less effective, as medical practitioners are finding that infections are increasingly difficult or impossible to treat. So how did we get here?
I think we've got to this point through overuse and abuse of antibiotics. We have relied on antibiotics for many years now for treatment of infection, but we've overused them to the extent that they're often used when they shouldn't be used, or we've used antibiotics that are too broad in spectrum. That means that they treat too many bacteria when we should be using more targeted antibiotics, or we've been giving them for too long. And that can apply both in human healthcare practice, but also increasingly it's recognized in agriculture as well.
In 2016, Gibraltar became the first UK overseas territory to adopt the MicroGuide, which is available to download via a free app. It's aimed at clinicians and offers information about which antibiotics to use, for which infection, and for how long.
That is really important, that we use targeted antibiotics, that we're not using an antibiotic that is too broad spectrum, but actually targets the bacteria that we want to treat for the right duration. We obviously, importantly, have to test samples in the laboratory to see what antibiotics work against which organism. That is a key component. And we are using some initiatives to also look at controlling the duration of antibiotics in hospital by asking clinicians to stop antibiotics when they're not needed, and also to make sure that they can switch from intravenous formulations to oral, which carry less side effects wherever possible.
But it's not only doctors who need to be informed, but patients too, with GPs saying they sometimes feel under pressure to prescribe antibiotics.
Yes, I do, and it's not only me that thinks that, because they've done research about it, and one of the main reasons why the doctors seems to prescribe antibiotics is, the first is, of course, when there is an assessment and we think that the infection might get worse if we don't prescribe antibiotics, and that will be the indication. But one of the other main reasons is the pressure from the patient, because of course we think we are unwell, we need antibiotics, but it's our role, and of course patient can help us with it, to trying to make and understand that an antibiotic is not the solution for everything, and is most of the time actually cough and colds, even sore throat, sometimes even urinary symptoms, is not caused by a bacteria, so antibiotic will actually do nothing for it. So there are different type of tests we can do, and one we actually introduced in the primary care center a couple of years ago is the Streptococcus test. So it tests for Streptococcus A, which is the bacteria that more commonly cause tonsillitis. So we can test, it's like the COVID test. It's a swab on the throat, and then in 5 minutes gives an answer, and it says if there is a bacterial infection or not. And if there's not, then the antibiotic are not needed, essentially.
The key message on World AMR Awareness Week is preventing antimicrobial resistance together.
We really need to improve what we're doing at the moment, because unfortunately there are already 5 million people every year in the world dying for multi-resistant antibiotics. We don't have infinite type of antibiotics, and if we don't battle the resistance, we will incur more and more of those issues. So our role as health professional is to keep updated and do our assessment at the best that we can to avoid to prescribe antibiotic when it's not needed. Patient can help with that, so like avoiding to take antibiotics that may be prescribed for someone else or being left over at home, for example, and of course to follow our advice if we think that an antibiotic is not required.
So you should always take an antibiotic only when prescribed by your doctor. You shouldn't share antibiotics between you or use any leftover antibiotics. And you shouldn't really be able to buy antibiotics over the counter without a prescription. They are prescription-only medicines. Those are the key, important points to remember. Just to highlight that an antibiotic isn't without its risk. So if you take an antibiotic when you don't need it, some carry significant side effects, and an antibiotic will have quite long-lasting effects on your microbiome, which are the so-called friendly bacteria that we all carry inside our guts and on our skin, and they do a very good job at protecting us from more harmful bacteria. So if you take an antibiotic when you don't need it, it can disrupt that microbiome, which may make you in turn more vulnerable to future infections.
Everyone has a role to play in the fight against antibiotic resistance, something worth remembering next time you make a trip to see the doctor.